Very good. Good evening. Hello, my name is Alice Johnson. I'm the Executive Director of the Illinois Nurses Association and your host for this edition of Illinois Nurse Today. Today's first guest is Sandra D. Robinson, President of the Illinois Nurses Association. Thank you for being here.
Thank you for having me.
So let's, before we get into our first topic, let's give an overview of what we'll be discussing tonight. So during the next 25 minutes, we're going to be discussing topics impacting nurses today, including right to work, Nurses Week, and public health as well. So let's begin with addressing right to work. So, Madam President, recently some of the public health nurses who are members of the Illinois Nurses Association attended a program presented by the University of Illinois Labor Education Program about right to work. So let's talk about some of the things that we learned during that training. First of all, let's start with just giving an explanation to the viewers at home of what right to work is. Can you tell us what is right to work and how does it impact nurses?
So the most important thing related to right to work is the fact that there's a law that has been passed or gone around trying to weaken the unions, trying to take away their right to unionize, trying to take away their right to be able to fight for their rights and stand up for their rights. And so that's going on all over the state of Illinois. And so the unions are, especially nurses, which we are all a part of, the American Federation of Labor, the AFL-CIO. We are all part of that union, and we are all standing up for our rights as union workers.
Excellent, excellent. And do we have a caller? Okay, so we'll take our first call.
Wow.
My call?
Yes, go ahead, caller.
Yes, I've seen a lot of coverage in the paper about the pension and what the Supreme Court handed down last week about the pension legislation. Does that involve nurses in any way?
Absolutely. That whole pension bill, that wonderful victory that we've all succeeded in receiving, that affect our nurses who work for the state. You have nurses who work in mental health institutions. You have nurses who work in prisons. And so that is a huge victory for us, that nurses have the ability to know that the court has protected their pensions.
Thank you. Thank you, caller. Excellent question. Excellent question. Moving on to, let's go back to the topic of right to work. So,
Okay.
what are some of the ways in which right to work can impact public health?
Well, since we have a great deal of our nurses who are a part of the Illinois Nurses Association, who are public health workers, this whole right to work affects public health workers everywhere. Those who work for the city, those who work for the state. And so if you have a law that's being passed that gives union members or nurses the ability to not form unions or participate in union rights, that's devastating to nurses or healthcare workers, period.
And do some of the provisions that are in the collective bargaining agreements that affect union nurses, do any of those collective bargaining agreements protect patient care and help nurses provide safe patient care?
Absolutely. When you have a nurse that belongs to a union, not only are they protected regarding their wages, but their safety while they're at work, their safety with their patients as well. And so that's important to a nurse. It's important that a nurse knows that when she goes to work, that she's protected, her environment is protected, and her environment of her patient is protected as well.
So the contracts actually protect not only the patients but also the nurses' health as well. Can
Absolutely.
you tell us some of the ways in which contracts protect nurses' health?
So, for instance, if as far as nurses' safety, so you have situations where nurses can be injured on the job. Of course, you want to know that you're definitely protected. If an injury comes up, you want to know that you have something in place that if something happens to you at work, you know that your union is there to support you and to protect you. Also, nurses who work under a license, they want to know that their nursing practice is protected as well. You don't want to have nurses in situations where they're doing something outside of their scope. And so that's why it's so important that you have a union to protect you each and every day.
Very good. So is the Illinois Nurses Association doing anything to educate nurses and their members about right to work and what it means?
Absolutely. And so we have begun going around to not only to our different local units and educating them on the definition of right to work and things they can do to help support, not making sure that this law passes. Not only are we doing education, but we're also educating our families, our friends, because we have something coming up very, very important this week that we want everybody to participate in. When you hear right to work, it's not meaning, oh, this is an opportunity for everybody in the state of Illinois to work. No, what they're telling you, what they're not telling you is destroying the right to be a part of a union. That's what it's actually doing.
Very good. So right to work does not mean that everybody gets a job. It means that right to work means that we're trying to destroy unions.
Absolutely.
Very good. So what can nurses do to fight back against right to work? Obviously, this is a really important issue that impacts nursing, impacts nurses' ability to provide safe patient care. What can you tell the nurses who are watching at home what they can do to try to protect union rights and protect nurses' rights and fight back against right to work? Oh, we have a caller, so let's take that caller before we go into our next question.
Good evening, ladies. I'm for nurses getting fair compensation. And what this governor is doing, especially since you ladies or gentlemen went to school and got the special type of training, you people should be fairly compensated. And coming up with these right to work is nothing more than a way to bust the union. And some people will not be, when you look at unions a lot of times, unions have been a way of moving people from into the middle income bracket. Now, if you want to move people into the middle income bracket, unions are the way to do it in terms of, especially with nurses, fair compensation. That's what it's all about. This governor, when he wants things, he wants people to work for nothing more than a buck and a bowl of rice.
Well, thank you so much for your comments. Anything to add to that?
Thank you for your support.
So it's obviously a caller that has a lot of passion about this issue. So what can he do? What can other nurses do? What can we do to fight back against right to work?
So on Thursday, there's going to be a vote in Springfield in which we want everybody, not just nurses. Nurses, make sure you tell your family, your friends, your co-workers, everybody. We want people to call their legislator, and the number is 1-888-412-6570. And just let your legislator know that you are opposed to anything related to right to work.
Okay. And if I don't know who my legislator is, can I still call this number?
Sure, they will direct you to your legislator.
Okay. So that phone number 888-412-6570 will connect you to your legislator. And I guess the caller should just make sure that they're informing their legislator that they're opposed to right to work, and the legislator should oppose any legislation forwarding a right to work agenda.
Absolutely.
Very good. Very good. Anything else that nurses can do to fight back against right to work?
I think the most important thing that nurses can do is first educate themselves on what right to work means. And when they educate themselves, they can educate their families, their friends, when they go to church, everywhere they go. Let someone know what is happening in this city and in this state.
Very good. Very good. So let's talk a little bit about another issue that's a hot topic this week for nurses. Let's discuss Nurses Week. So we're coming to the end of National Nurses Week. Let's start by just talking a little bit about what that is. What is Nurses Week?
So Nurses Week is a week-long celebration which starts May 6th through the 12th. It ends on the day of Florence Nightingale's birthday. And so what we do is during that long week, that whole week, we want to recognize the importance of what nurses do every day. The nurses are taking care of your family members. They're taking care of all types of people, all walks of life. And so it's important that during this week that nurses are acknowledged for what they do. It is extremely important that they are given the support that they need to do the work that they do every day. And so I think it is extremely important that during May 6th through the 12th that you hug a nurse, acknowledge a nurse, and just tell them thank you for what you do for my family and my friends.
Very good. Those are some great suggestions for acknowledging nurses during Nurses Week. Any ways that can you tell us about some of the events that the Illinois Nurses Association had to celebrate Nurses Week?
Sure. On May 5th, we went down to St. Louis and we went to a Cubs and Cardinals game. So we had a fun outing. All the nurses got together and just had a nice evening. On the next day, which was May 6th, we had a student job fair. And so we had an opportunity to take some time. The event lasted from 11 a.m. to 6 p.m., in which we had student nurses had the opportunity of having participating in a job fair. So you had people, jobs and careers from the Department of Corrections, Veterans Affairs, public health, and so it gave student nurses the opportunity to begin their careers in interviewing and talking with people who they may potentially be working for. And so it was a wonderful event. We had a reception from 4 to 6 in which we invited legislators who came and also celebrated Nurses Week with us as well.
Very good. And were there educational programs provided as well?
Yes, it was. So there was one program that talked about, medication errors, which is extremely important to all of nursing. And then we learned about the political process, the role that nurses can play in the political process, because as you can see with rights of work and with the pension, those being in politics is very important for nurses as well.
And do you see being politically educated as an important role for nurses, as not only for their for working conditions such as pension and right to work, but also as part of being a patient advocate?
Absolutely, especially with these upcoming cuts that affect public health. I mean, what's going to happen to your mentally ill or your mentally challenged? What's going to happen to all the programs where nurses are caring for people in developmental homes, or in your state institutions like the University of Illinois? When you cut benefits, how is that going to affect people getting care, getting access to care? And so it's extremely important that we be involved in the political arena, especially when it comes to the health of patients.
So what are some ways that nurses at home can get involved in the political process?
I think one of the of course, for those nurses who are in the Illinois Nurses Association, it is extremely important that you attend. We have a fantastic lobbyist who is excellent in educating nurses on their role that they play. We have a PAC where nurses can join, and so we can help collect dollars to help support an issue that's related to nursing. All of nursing, we're calling out for all of nursing to get involved. The retired nurses, come and join us. Let's bring our association together so that we can make a big impact on issues that affect us as well.
So if a nurse wants to donate to the PAC or become politically involved, maybe invite INA out to give a program on political activism, what should they do?
Call 312-419-2900.
Very good. Very good. So, what are some of the other ways that nurses can celebrate Nurses Week?
Well, for instance, just this past Friday, there were a group of nurses who made the decision that, well, let's take ourselves out this week. Let's celebrate ourselves, which is extremely important. Sometimes nurses are so beaten down and so mentally drained and tired that they have to remember to take care of themselves. And so it is good that they take the time to celebrate their careers and celebrate themselves. And it's good that if they work for an institution that celebrates them as well, recognize them, recognize that the work that they do for the public, for all of the patients that they see on a day-to-day basis, on the day shift, the evening shift, and the night shift. Nurses work in all capacities, especially those nurses who work in prisons, the things that they see, the nurses that work in mental institutions. Our nurses deserve the best, and they deserve to be celebrated and acknowledged.
You, as the president of the Illinois Nurses Association, you have had the opportunity to travel the state recently and talk with a lot of our members. What are some of the issues that you're finding are really pressing right now for our members?
One of the issues that was really disturbing for me was that we have nurses in mental institutions who are being attacked. And so their safety should be a number one priority regarding their employer. We have to protect them. Those nurses who are under such scrutiny like that, they need to be protected. You have nurses who are doing mandatory overtime, working too many hours, working too long. And so it's important that they too are protected, and that the laws protect them, and that their employers protect them as well.
All right, terrific. Thank you so much, Sandra, for being with us today and sharing all of this wonderful information. We greatly appreciated it.
And thank you for having me.
Thank you. Thank you. So we're going to take a short break and move on to our next guest. You are watching CAN TV's Hotline 21, a live call-in show. Call 312-738-1060 with your comments or questions. Okay, so we go back. Okay, very good. And I would like to say welcome to Latonya Smith. She is a chair of an INA, Illinois Nurses Association local unit. She is a public health nurse and also a labor and delivery nurse. So Thank you very much for being with us today.
Thank you for having me.
Thank you. So let's talk about public health nursing. We've talked about right to work and how that can affect the public health. Tell us a little bit about public health nursing, or what public health is and why it's important.
Yes, public health nursing incorporates the community, the family, and the individuals through the whole state of Illinois. So you have public health nurses that work in different counties, and these public health nurses do a variety of things. They help treat TB patients. They go out to the homes and check on pregnant women, and it doesn't matter if she's a first-time mom or not. They check on infants up to 5 years of age. They give immunizations. You have nurse practitioners who do ST testing and treatment, and nurses that go out to bring those clients in. You have nurses that work in the prison system, and you have nurses that also work for DCFS that go out to homes. Public health nurses is a variety of things, covers many things and many illnesses. They work with schools. They work with nursing homes to provide immunization to the elderly, to provide education as far as nutrition, prenatal care and nutrition for adolescents who are obese in most elementary schools throughout the state of Illinois.
Wow, those are some extremely important areas. It sounds like public health nursing addresses maybe some of our most vulnerable members of society, and really protect the entire public when you're talking about things like the spread of STIs and that type of thing. If you, as a public health nurse, have the continued pressures that happen on public health or public budgets, and the cutting of resources and the more and more pressure that there is on public resources, have you seen an impact on the patients and impact in the public health arena?
Yeah, especially with the nurses. Most nurses have to go out alone because of the budget cuts. So you have nurses that currently throughout the state of Illinois going to Ebola monitoring. Those that are coming in from West Africa and different areas that are affected by Ebola, these public health nurses go out alone to do the monitoring. They go into some of the tougher neighborhoods in Chicago and the surrounding suburbs, county and DuPage County, alone to do these visits. With those cutbacks, they're working with less nurses and less materials to do the education that is needed because of the budget cuts.
Oh, that's really scary stuff when you're talking about a disease like Ebola and nurses being put out alone to work on an issue like that.
Yes. They go to the homes alone. They go see the children, and they have many items with them. They have scales because, as you know, public health nurses, when they do go into the home, they do assessments of the baby and the family, which means they weigh the baby, they educate the moms. Yeah.
Thank you. And we have a caller with a question.
Good evening, ladies. I want to ask you a question in terms of the VIEW and the other budget cuts as well that haven't been mentioned. Patients that are dealing with inner-life issues, they seem to be one of the least vulnerable, and sometimes their issues may not be taken care of because of all these different budget cuts. I'd like to hear your viewpoints on that.
Okay. Well, with those budget cuts, public health nurses try to come into the home and they try to help as much as possible. They have lists of resources that are in your neighborhoods and your communities that most members can go to. They have sometimes lists of your representatives that you can talk with and discuss some of those issues that you have. The nurses can provide as much resources as you need at that time of the issues, within the issues that you have. Even though we have the budget cuts, nurses, we were born and live and thrive on being nurses, so we try to help you with whatever we can.
As we were talking before about political activism, would you say that's an important area for nurses to be politically active and talking to your legislator about the importance of providing enough resources for public health for the mentally ill?
Yes. It's best to contact your local representative. In some states and in some cities, you have your aldermen, who is your first line of political entry. You talk to them, you discuss your issues with them, and then you also talk to your U.S. representative, your House representative, your senator, and your Cook County commissioners. There are many commissioners throughout the state of Illinois that covers Cook County and cover the city of Chicago as well. You contact them. That's what they're there for. They're there to service you. So if you have any issues or concerns, you should take your concerns to those that you have voted into office.
Very good, very good. One other question about public health nursing. So earlier we were talking about students. Right now we're at a time where there's a lot of graduating nursing students. They're looking at taking their boards. What advice would you have for a student who is considering going into a career in public health nursing?
Public health nursing is wonderful. Once you pass boards, you should study very, very hard. Just study first, pass boards, and begin looking at jobs. Remember, public health nursing is not just in your state. It's through the United States, so you can go on U.S. jobs. They have the United States Public Health Service that you can apply and work on Indian Reservation. You can work in the U.S. Bureau of Prisons. You can also work in the Navy, the Army, all service. Nurses also service servicemen. So you can have a career that spans from being in a hospital to in the community as a public health nurse, as an Army's reservist, or even in mental health institution or nursing homes. Nursing is a wonderful career, and it is 80% of Americans trust nurses. I believe 4-ranked nurse practitioner is the number 2 best position to have in the United States.
Oh, and we have another caller.
Hi, caller.
Hi, yes. I was wondering, where do we send clients? I'm a nurse also. Where do I send clients to get TB testing since the health department closed up all of their TB clinics?
Currently, the city of Chicago has what is called federally qualified health centers throughout the city of Chicago. You can go onto the city website or you can call 311 and they will direct you to your nearest health center and they can guide you on where to get a TB test, or you can always contact your primary provider. Thank you, caller.
Very good. Very good. So even with all of the pressures that are on nurses and the pressures that are on resources, you would still recommend nursing and public health nursing as a career?
Yes, public health nurse, if you love working in the community, you love working with your neighbors, you love working with people in your church, public health nursing is the perfect job for you. Because you will be in the community, not in a hospital, going to people's homes, in schools, nursing homes, senior citizens, doing education and hands-on.
Very good. Well, thank you so much, Latonya, for being here and
Thank you for having me.
educating us about public health nursing and nursing as a career. So looks like we are out of time, so we are going to be wrapping up now. Thank you so much for being a part of our show today. Thank you to both of our guests. You can learn more about the Illinois Nurses Association by contacting us at 312-419-2900 in Chicago or 217-523-0783 in Springfield, or by visiting our website at illinoisnurses.com. And also, just a reminder on that Defeat Right to Work hotline number, that is 888-412-6570. So be sure to make that phone call and let your legislator know that you oppose right to work. So thank you and have a great night.